thanks for joining us for another episode of the Deals for Dentists podcast. And I'm really excited about having Dr. Laura Brenner joining us. And she is coming from Denver, Colorado. And her company is called
Lolabees.
Lolabees. Okay. I would have butchered the name of that. Lolabees Career Coaching. And Laura helps dentists with life coaching, but also has networking conferences where you can engage with like-minded dentists who want more than what traditional models offer. The conference is 100% virtual. You can go to Deals for Dentists and click on Lolabee's listing and enjoy $50 off using the exclusive coupon code. Also, mention this podcast and you can get $100 off Dr. Brenner's one-on-one coaching program. So thanks so much for joining us. How you been?
I'm great. Thanks for having me.
Yeah, so it's a small world. Laura and I, we both went to Tulane together, and we just recently reconnected because I had no idea that she was a dentist, or as you put it, a recovering dentist, which I think is hilarious to actually put it like that. But do we ever really recover? Can you
Yes.
actually? You can. Okay.
Or it's a constant process of recovering. But
Right. Um, so we went to Tulane together, and if anyone knows Tulane, it's right in New Orleans, and going there as an 18-year-old, 18 to 21, it's quite a ride. Um, and in fact, I think my first night there, the school was throwing a keg party. So this was just for freshmen, and then it was followed by a riverboat cruise. And I think I was 17, and no, I was 18 because my birthday's July 21st. So I just turned 18, and the drinking age was 18 in New Orleans at the time. And I remember walking by one of the Tulane policemen, and he said, "Don't get too wasted tonight, so you don't find your way back to your dorm room." And right then, I knew I was in someplace special. And so my time at Tulane, and I remember having a lot of laughs with you, but it's a bit foggy on the memory there. But it's great to reconnect.
yeah, I was pretty floored when you reached out to me. I was like, this is going way, 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 way back.
Way deep
How'd we
into
both
the
end up here?
yeah. Well,
You know what
actually,
would have been what would have been cool is if we should get some photos and each show a photo of each of us from that year.
yeah, I looked like I looked like I was 12 when I was 18, so it wasn't a pretty sight. And I didn't have the smartphones weren't around then, which is probably a good thing. So there's not much photo footage of me, but that would be great if we had some pictures. So actually, I became one of the ways I became a dentist. I actually went to Tulane as a business major, and then I switched to psychology. But I was at the Rendon Inn. I was watching the band Cowboy Mouth, which I don't know if they still exist. And I had a beer bottle in my hand, and I missed, and I broke number 9, central incisor. And I went to a local dentist, and he patched me up, and I just really liked the whole experience. And my dad is also a dentist, so I've always been around it. But so then I started, hanging around my dad's office and looking into. I started taking the prereq classes, and I took a year off after Tulane because Tulane didn't have a pre-med or pre-dental major. So I did psychology and then took the prereq classes on the side, and then I took a year off and I taught tennis at Woburn Racket Club and took physics and biology, and then applied to Nova and got into Nova, and then went on to become a dentist. So that was my story. What was your story?
Oh yeah, so I started, mine was a little bit earlier. And it was probably the day I got my braces off, the first day of junior year of high school. And I remember feeling so excited by how big and white my teeth looked. And I hated getting them on. That the first day I got braces on was the first day I ever said the F word in front of my mom. She kind of let it slide. But the day I got my braces off, I just was so excited by my smile, and I thought, oh, this is really cool. I want to help other people smile. So that's what got me into it, thinking that I wanted to straighten teeth and help people have pretty smiles. So I went into Tulane knowing that I could major in anything because I just had to take the 5 prerequisite classes. And so I majored in Spanish, which is very different, but it was what I actually loved. I looking back, I can say that.
Are
You know,
you
I
are
was
you fluent?
I moved to Spain. I took a year off between college and dental school, and I moved to Madrid. And I really was pretty fluent then, but that's been a while. I could tell you how long it's been, at least 20 years.
Hmm.
Um, Almost 25, probably 22 or 3. So yeah, I took a year off. I had applied to dental school and I just felt like I want to do something cool. I don't want to go straight from college to dental school. I felt like that was felt kind of boring for me. So I just took a year off and went to Spain. And I went to Baylor College of Dentistry, which is now A&M, Texas A&M. And
Okay.
they allowed me to defer a year. So it was kind of a nice year where I knew what my future was. And I just had to get myself back home at the end of that year.
That sounds a lot more fun than teaching tennis at Woburn Racket Club. But that's pretty cool that you had that year, knowing you were already in school
Yeah.
and just having fun. So and then so you finished school, you graduated, and then you started practicing, and then take us from there. What happened?
Yeah. So I moved out to Denver. I knew I wanted to move here and I got a job. It was in a really fast paced practice that was a private practice, but the owner took over 150 different insurances. So it was very, very fast paced. So I would see about 30 patients a day. Um, I was really like eager, really excited. If I had a procedure that was new, he had 2 offices, so I'd call him up on the phone and say, hey, I've got to do such and such. Can you walk me through this? And he would tell me how to do it over the phone. I'd be like, okay, I'm going to go back and do it. And I wasn't scared. I was excited. I was hopeful. I thought my future was going to be a lot of fun. Um, and I was excited to have a paycheck and not have to study for tests anymore, all that good stuff. And that was about 3 years in. Then I started to that just kind of slipped away. I became kind of jaded and I became really scared. I had enough experiences in the office that came back to bite me in the butt, that made me really afraid of taking risks. When I started, I just described being excited to try new things, and I became very risk averse, and I became I was afraid of getting sued all the time. I got very, I'd always go home and worry. I felt like I needed all of my work to be perfect. I didn't want my patients to get mad at me. And it created a ton of stress. And I really started to question what I was doing in this career and could I hack it?
Yeah. Now, was this? Do you think it was the type of practice, the fact that it was such a high volume? Do you think it was that, or do you think like did you actually enjoy the technical work? Was it just the emotional side of the business, where dealing with the patients? What was it that do you think was making you so nervous or anxious?
Yeah, I think that did not help. It really started me off in a way on the wrong foot, like it really created an environment where I didn't feel like I had enough time to get to know my patients and create the patient relationships. And you probably remember in dental school, they used to always talk about how making your relationships with your patients is the most important thing. And so I felt like I was running around with like a chicken with my head cut off. And so I didn't ever have a chance to do that. So I felt very vulnerable and on the defensive from the standpoint of that. I also didn't really I had a boss, but I didn't have a good mentor. And I didn't really have a good community of people around me. So I was very isolated. And when I was experiencing some of those feelings, I didn't really have anyone to talk to because he didn't really get it. He wasn't bothered by the same things I was. And so he was not really that type of support. And you can't always let your boss know these things anyway. You kind of have to protect yourself. And so, yeah, I think it was partly the job. I think that was not the best environment for me to start out in. Partly the environment. I and for me it was, I like the technical part of dentistry. I like doing work with my hands. The challenge for me was always the patients. And so
Hmm.
it was managing them and managing their expectations and drawing boundaries. I didn't have good boundaries of how to know really, like, what was human, what can I do? There's only so much we can do as human beings, and we can't be perfect. So I put a lot of pressure on myself. So when things would go wrong, I would just blame myself and lose sleep for nights over it. And when things would go right, I just, that was expected. So I never really celebrated that.
Yeah. So it's, what you're, this whole story that you're telling me is so familiar to my story. But um, I just wanted to back up 1 second. Do you think that was this like a high pressure area where you were working? Because I've worked in probably 8 to 10 offices, and I found that the closer I was to Boston, I'm right now I'm 30 minutes outside of Boston, in a town that is, I consider, kind of under the radar. It's a very well educated town. It's the prices of the homes are affordable, but the schools are really good. So it's a very strong community. The people are nice. I'm part of the community because I live in the town that I work in. But I worked in some other offices, like Newton, Massachusetts, Brookline, and the clientele there was more demanding. And I think that I'd give them a treatment plan, and then I was like ready for a debate on you know my treatment plan. So I think that caused a lot of stress for me, was just the type of patient I was dealing with. A lot of lawyers and doctors, and you know that type of clientele. Was that similar to your situation?
It actually was not. This clientele, because it was so heavily insurance based,
Hmm.
um, this was not the people that could afford most of them. They were not the people who could afford the private pay and out of pocket payments. So it was more the mentality of, well, will my insurance cover it?
Oh
Like
yeah.
really dependent on that.
Hmm.
And arguing they didn't like prices, even though, I mean, I was doing a crown for $300. I'd do a
Hmm.
crown and build up sometimes for some of these insurance plans, and that was still too high for some people. So something's gonna, when you're doing work, a crown that you have to pay for lab fees and with all the overhead for that inexpensive, something's got to give, right? It's either going to be your time with me, or it might be the quality of the lab, and or it's that's how you make up for it, by seeing a lot of patients in a day. And so when you're with those people and you want to give them more personalized care, you can't.
Yeah.
And they want it too,
Yeah.
you know
That high volume type of practice. I think maybe first year or two out, I think a good mix would be good. To have that high volume experience, maybe for a year to pick up your speed, and then a good mixture of different types of offices. I think would be really good. But to do that for so many years, I think it would just wear you down. So was it? Did you say around year three that you started to kind of question your place in the profession?
Yeah, so that happened in year 3, and I at that point thought, I hate this. I need to quit.
Hmm.
And that was in 2004. So I graduated from Baylor in '01, and then in 2004 I wanted to quit, and the economy was getting a little wonky at the time. So I just convinced myself it was a bad time to do that, and I should feel lucky to have a job. So at that point, I actually did reach out to our Burkhart rep, who I was friendly with, and I asked him to go to lunch with me, and I asked him if he knew of any job openings in his company that I could do that were, like his job. And he talked me out of it. He felt like it would be a waste of my career, and the grass is always greener. It's not so great doing this. Well, he's no longer doing that anymore. So clearly there were, it wasn't this dream job. But for me at the time, it seemed like, what else can I do? And when he talked me out of it, I did realize that, okay, I've had one job, like you said, I was there for way too long. 1 year probably would have been good, but I tend to be somewhat loyal, and I sort of stick it out, and that's what I did. So I around year 4, I was able to leave, and I found the opposite type of practice. And that
Mhm.
was a private practice that did not take any insurance. It was a really, really high tech, brand new office. And so it was, I went from seeing 30 patients a day to, if my one patient that day canceled, I'd go in the bathroom and cry because I had nothing to do all day. So, um, yeah, finding that balance is so important. And I actually stayed at that job. We can get into more details if you want, but I stayed there for about 3 years, and then ultimately found my third job in over 10 years that was a good balance between the two. So it was
Okay.
kind of in the middle, really nice. It was a panky practice, and I had enough patients that I could be somewhat engaged, and but not too many, so I could create the time to have relationships with my patients, which was really the most important thing for me.
So you went from an office that took 150 insurances to a total fee for service office, and
Yep.
then now, did you think that that was going to be like the spark you needed to change your relationship with the career? And then what happened from there? And then tell us about that third job where it was kind of that nice mix.
Yeah. So that middle job, that middle associateship, I made a mistake. My boss, that the future boss, offered me a percentage of collections with no guaranteed minimum on his part, and I was like, I'll crush that. I crushed that at my last office. He offered me a percentage of production, and I always doubled my base salary, right? So I went into this naively thinking that it would be the same. And so a big mistake, I share this for people who are looking to get into different associateships, is it was important I learned that, yes, it's good for me to be paid on production because that puts me on the hook, right? Like I have to be accountable for what I'm doing. But it's also good for the owner dentist to be accountable in some way too, because in that case, he could just take everything he wanted if he wanted to. That wasn't always how it worked out, but that just for setting it up as a situation. So many days, part of the reason I would go into the bathroom and cry is if I had a crown patient, that'd be great. That was all I needed. But if that patient canceled, I made $0 for an entire day of sitting in the
Mhm.
office. So I think that's just a good little tip for people, is if you're going to do something, it's good to have both sides being accountable. Um, but anyway, I thought that was going to be a great, like the opposite, like this is my dream practice. And I went to Panky, I tried to save my career by going to the Panky Institute 4 or 5 times, and I always loved going. I had a great time when I went, and they really teach you, a lot about treating patients in dentistry and not treating just teeth. But
Mhm.
they also teach you to take care of yourself, and to to learn about how you can be put in this equation of care. And it was great, but when I'd get back to the office, I never really knew how to put that more complex dentistry into use, and I always sort of slipped back into my old ways. And I really thought that about 5 years in, I just needed the experience to just be good at what I was doing. And the better I would get, then the less insecure and anxious and stressed out I would feel. And at year 5, that did not happen. Um, so ultimately, I networked with one of the main lead instructors at Panky, and he connected me with another local Denver office that was a very large group practice with, I think, at least 90%, the majority of the dentists who worked there were Panky trained. So it was a good fit. It allowed me to see more patients. I started working with a guy who was, gosh, I think he was 72 at the time and eventually going to retire. So it was a situation that was a little more equally weighted compared to the one before that. But,
Hmm.
you know, I should add that looking back, this is kind of an interesting thing that I don't really talk about that much. But with associateships, there's that divide, right, between owners and associates. And I think owners feel like they've worked so hard to get where they are, and that associates sort of take that for granted and don't really understand. And I see both sides. Associates on the other side feel like, hey, I'm here. I could make your life so much easier. You can pay me to do the work for you,
Hmm.
you know? And things get lost in the way. And in that second associateship job, I had come from a job where patients were handed to me, and I
Hmm.
liked that and I wanted that. But there was this expectation that I should be building the practice as well. And I just didn't know how to. And I really didn't want to. And I think a lot of associates feel that we just want to do the dentistry. And I understand how that's frustrating for owners. But as associates, that's hard too. So, at the time, I remember being frustrated because he wasn't handing me enough patients. And I'm sure he was annoyed with me because I wasn't doing anything to bring in patients. But looking back, what I know is that I didn't want to bring in patients because I that meant I had to do more of the thing I didn't like doing. And I didn't feel confident and proud enough to get people in to sit in my chair because I was always scared something was going to go wrong.
And then, so when, and did you say when you really started to think about leaving the profession was around year 7?
Yes, that's when it happened again. That was probably a little while into my third job,
Okay.
maybe about a year into my third job. And it was good in some ways, but I could start to see that my boss, who was nearing retirement age, was kind of pulling that back and wouldn't ever use the word retire. You know, it was a bad word. And uh, uh, when he had initially started taking Mondays off, so I could have all the patients on Mondays, about a year in, he started coming back in again on Mondays.
Hmm. Hmm.
And, I dealt with really difficult staff that were family members that weren't held accountable. So the
Yeah.
day to day, I was carrying the weight of the world on my shoulders because I just didn't have any support. And so
Yeah.
it was kind of like, you know what? I've tried every kind of practice and I'm out of here,
Hmm.
you know? So, like, if this doesn't work out, I'm done.
And was it year 10 where you called it a career?
Called it, yeah.
Yeah.
So, um, I in year 7, I reached out to a career coach, and I just because I was just talking, talk, 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 talk. I didn't ever do anything. I would just talk about how unhappy I was, and
Hmm.
so I knew I needed help. So I called a career coach, and we worked together for a while. And I actually worked with her on how to tolerate dentistry a little bit better, how to cope with the challenges and how to make it better. And it helped for a little while. And then it really wasn't working. And I ended up getting therapy. I worked with a therapist. And just between that and a lot of soul searching, I finally started to realize that I needed to just kind of find a way to get into action. So
Hmm.
from year 7 to it took me about 3 years to make that transition out.
So I like to use the word niche at least once a podcast. So you are very niche because you're a life coach, but you are also a dentist. So I'm assuming the therapist and the life coach that you consulted with didn't have any dental background, correct?
Correct. Yeah.
Yeah.
And I love telling this story because it's so um indicative of why it's so important to have the dental background. Is I remember talking to her about being really unhappy and hating my career. And she was trying to help me understand how important, like, what's the one thing that makes us happy in career? What makes us feel fulfilled? It's being of service. And so she was trying to get me to see how could I be of service. And at the time, I remember feeling like a 4-year old wanting to just like stomp my hands and feet and scream and say, I don't want to be of service. I don't want to help people. Like
Mm-hmm.
I am beaten down and I'm jaded and I don't want to help anyone. And what was interesting about that is I felt like crap about myself,
Mm-hmm.
because I was like, what is wrong with me that I don't want to help people? And I'm a bad person. I'm supposed to be this person who wants to help people, and I'd rather work with lab rats. And
Yep.
looking back, I see this now. I didn't know it at the time. I see that dentistry is all about being of service to others. And what happens to us, the thing that burns us out and the thing that makes us feel so jaded is that we are like taking that concept too far and we sacrifice ourselves, we sacrifice our own well-being in the process of trying to be of service to other people. So we actually push ourselves to the opposite direction of it and we can't do it anymore. We just deplete ourselves so we don't want to help anyone. And that's something that only a dentist would know, you
Yeah,
know?
I had a similar, my story just it sounds so similar to yours where I've been practicing 18, carry the one and the two, maybe 18 years. So and I started seeing a therapist maybe 2 or 3 years ago, when I finally said I need to start doing something about my mental health because like you, um, I didn't like any part of the profession. I didn't like the technical part. I didn't like dealing with the patients. I'm an introvert, so for me, getting the energy to see 30 or 40 patients a day was totally exhausting. I'd come home and I'd just want to like just shut it down and stare at the wall for an hour. So I started to see a local therapist who was great, but I was trying to put everything in context. She was not a dentist; she was a therapist, and I'd go into a long story about the office manager and the hygienist and the assistant and the whole context of my stress, and she'd be like, "So, what does the assistant do again?" And I'd be like, this is like I just spent like this exhausting energy trying to explain to this story, and she just someone who's walked in a dentist's shoes like yourself, would be a lot easier for me to if to connect. Whereas this therapist was great, but she was not a dentist and didn't know the dental business or background or what we go through on a day-to-day basis. Um, so that part was frustrating, but it really really helped me. That along with so therapy, getting on some medications, finding the right combination of medications was a game changer. Um, I went through all the phases of dentistry, the associate. Um, I, I worked as like a traveling implant guy where I would place and restore implants in different offices. I associated in many offices, and then I went through the process of transitioning to become an owner, or should I just buy my own office, or should I partner in the one that I'm at now? And then I went through the process of becoming an owner. So each phase had its own stresses and totally different reasons. As an associate, like you said, you want to please everyone, the staff, the owner, the patients. You're trying to hone your skills. You don't have any control over your schedule or even ordering supplies. So like me, I wanted to please everyone, and that is stressful, especially an introvert like myself. It takes a lot out of me to really engage and be social, and put that happy face on, even though I'm exhausted. Um, and then the whole process of even thinking about transitioning to become an owner was extremely stressful. Then becoming the owner was probably the most stressful part because you're dealing with the staff and all the business that goes along with it. And as you know, they don't teach you any of that in school. So I was just all those wearing those different hats and all those thoughts going through my head. I said I've got to do something. So that's when I started seeing therapy. I started actually doing less yoga and more tennis. I started getting back into tennis, which was really good for me. Just listening to music, stretching a lot, and then the biggest one was just not giving an F. I just stopped caring, and I'm not talking about caring about my patients or the treatment. I stopped caring what people thought about me at work. I stopped caring if patients didn't like me. I stopped caring if they didn't schedule that appointment. I stopped caring if the staff didn't like me. And it was this whole change of mindset, which probably took, a couple of years to do. That, along with getting my staff to work the way that I wanted to work, especially with my assistants. So now I actually have turned the corner and I show up to work and I enjoy going to work every day and I'm not coming home stressed like I used to. So I went through a lot of what you were going through, but I was able to get out of it and I'm, a lot happier now.
That's awesome.
Yeah.
And I think the biggest key is the not caring about what people think of you. That's what it comes down to, because that's where, when you're talking to your patients or your team and you're feeling drained and exhausted by it, I kind of describe it as, it's not because you're connecting with them, it's because you're being that like dancing monkey trying to entertain everyone and juggle and dance and make everyone happy and make sure they're having fun and that all the results are good. And that's different from really connecting with a person and helping them out.
Yeah, and no one wants a dentist in a bad mood. It's you got to always be
No,
on.
you have to. A friend of
And
mine one time said to me, he was like, we can never have a bad day.
mhm.
He's like, everyone else gets to have a bad day around me. My team, my patients, they get to come in and they get to unload on me and tell me what a bad day that they've had, but I never get to have a bad day. And that creates a lot of pressure. So I think that's awesome that you got therapy and really became proactive about helping yourself. And that's what we have to do. It's like, if you see something's going wrong like this, you got to do something about it. It's not
Yeah,
going to go away.
so yeah, and also, my personality being an introvert, I think there's a big difference being an introvert and an extrovert in this profession. So my partner is like, he's a total extrovert. He's like, he re-energizes himself by engaging and talking, whereas personally, I re-energize by staring at the wall for an hour. I need to decompress and kind of settle down and not talk to anyone for a while. Um, so for me, going from room to room and making that patient feel like they're the only patient I'm seeing that day and being on, and meanwhile I have a patient in the other room that I'm still thinking about, but I can't let that hygiene exam that I'm doing right now know that I'm not totally focused on them. So for me as an introvert, that was really a big challenge and totally exhausting. Um, that, along with the fact that we're doing surgery on someone that's awake, we're staring at this 1 millimeter space, um, and I was also to top it all off, was having shoulder pain. So also having physical pain is mentally exhausting. So you had all those factors in, and I would get home and just be just toast.
Then you've nothing to give your family.
Yeah, exactly. Yep.
Yeah,
You get home and you're junk.
right.
Um, so to me, that was obviously a wake up call that I needed to do something and make some changes. And mentally, I just had to stop caring what people thought. And a lot of it was staff. As an owner, there was some drama queens and some. I mean, their staff was fighting and yelling at each other. People were crying, and I mean, there's all this stress in the office that was just tolerated for years. And I was like the bad cop coming in, like the new sheriff in town, and changing some things. And we had to get rid of some people. Some people left on their own and kind of weeded themselves out. But there was staff members that I didn't enjoy going to work with every day, and that's not a good thing. Especially as an owner, you're paying them. You want to go into work every day with people you enjoy working with. And if it's not in the cards, then either they need to leave or you need to get rid of them. But don't, take control of your practice. Don't let your practice take control of you, especially when it comes to the people you're working with.
Right. And I would add to that is when you see something's not working, don't stay stuck
Mm-hmm.
because you're going to wake up a year from now and you'll be in the same place.
Yeah, I want to go back to where you said, um, that you felt isolated. This practice, this business can be very isolating, especially if you're a solo practitioner and you're the only one in the office. You can totally be in a little bubble, and now there's Dental Town, and there's a lot of Facebook groups and a lot of ways to engage with your peers. But when I was first, coming up, into my practice, into my career and associating, I didn't know about those platforms. Um, there was a few classmates that I would reach out to and we'd talk. But I was also doing something a bit different. Back then I was placing and restoring my own implants. So I was like the only one that I knew that I was doing that. And that really caused a lot of stress for me because I didn't have anyone to really connect with that was doing the same thing as me. And I was also doing some procedures that I think was a little out of my comfort zone. And I was constantly thinking about those patients at night. I just did a big bone graft or a large implant case, and those kept me up at night. Um, and it's not like other professions where you go out and you have that 5 o'clock beer after work, with your colleagues, like if you're, accountant or lawyer or working in an office, as dentists, you just go home and you take it home with you. So it's can be very isolating profession. Um, so I wanted to ask you about so you left dentistry, and then you wrote a blog that went viral, right? Can you tell us about
I
that?
did. Yeah. So so I started blogging. I was so stuck. I didn't know how to get out of dentistry. And so it all started actually. I decided to enter a video contest, like a travel show host contest, where I had to make a 1 minute video and submit it and try to get people to vote for me. And if I won, I would win like a 6 month traveling stint being a show host for this, internet travel company, and I would win a house wherever I wanted in any of these cities that I was gonna be part. Well, anyway, long story short, I didn't win. There were professionals applying, and I just did it for fun and creativity. And when I was doing it, it was really fun because I had something different to focus on, something creative, something to think about, something to take my mind off of my stress. And then when I didn't win, I got pretty upset and I felt like I have nothing now, but this was so great. Like, how can I take this and create something out of it? So I was like, okay, if I can't be a travel show host, why don't I start a blog? And I'll blog about traveling and I like food, and nobody read my blog. There's a million travel blogs out there. No one read it. I had like 7 followers. And one day I was reading a list of the different blogs. So I blog with WordPress, and WordPress is really good for community, and they'll oftentimes promote blogs on it. So they were promoting a blog that they thought was great, like a really funny topic, and it was titled 10 Reasons I Hate the Dentist. And she was kidding. She was being sarcastic. And I was like, oh, let me see what this is. And I was like, really? I just was so like, ugh, eye roll. We've heard this so much, all the things that you hate about the dentist. So I was like, you know what? I'm going to write, here's 10 reasons your dentist probably hates you too. So it was like a direct response to this blog post. And I sat on it. I didn't post it because I knew I still had a few more months in dentistry. And by this point, I had actually found my exit strategy. And part of helping me find that was this blogging for about a year. It really opened up my mind, and it opened up my creativity, and I started to gain a little more confidence that I could do anything outside of dentistry, because we always think that we've been taught such specific set of skills in dentistry that there's nothing else we can do, and it's actually not true, but a lot of us think that. And so, I had been blogging, that helped me get into something else. And then I saw this post knowing I was going to quit in about 3 months. I sat on it. And then when I quit, because I didn't want patients to think I was a bad dentist or a mean person. And it was very sarcastic, very tongue in cheek. I posted it it was like kind of like one of those kidding, not kidding types of commentaries.
Mm-hmm.
And I posted it, and literally that night it went viral. My phone was just going off with alerts, about comments and um,
What does that
people
mean to go
liking my
viral?
post. What's that?
What does that mean to go
So that's
viral?
a great question, because I actually looked it up when it happened. And you've gone viral when someone who finds out about it,
Mm-hmm.
not from you.
Okay.
So I guess that'd be probably bigger than just gossip.
Yeah.
but yeah, so numbers wise, I had about 300,000 hits in 3 days.
Wow.
And at the time, I had 55,000 Facebook shares, which I've lost count of because I've switched over my website. So I don't have that tracking anymore. But about a week after I posted it, I went to a CE event that one of my friends' study clubs was hosting. And they had actually invited my husband to be a guest speaker to talk about ergonomics and stuff. And he's not a dentist, but he's a chiropractor and works with people with chronic injuries and stuff like that. Um, so they invited me along since he was speaking. And I remember hanging out, and somebody walked in the door with my post printed out, and they were passing it around. And before everyone arrived, I was having a conversation with a dentist who's older, and he retired because he was at the retirement age, right? And I was like, yeah, I quit dentistry last week. And he was like, well, I quit too, right? We were joking about it. And he ran over to me with this piece of paper printed out. And he was like, you've got to see this. You're going to love it. And I just started laughing. I looked at it. I was like, I wrote that. That's how, when you're viral, you've gone
Mm-hmm.
viral. So that was a fun experience. The reason I tell you that story is because I thought I was the only person in the world who was struggling in dentistry. This was 2011. No one was talking about burnout. If you look at all the classic signs of burnout, that's what I had. I didn't know it was burnout. I just thought I hated dentistry. And, it may have been a combination of both, right? I think there's a very fine line between the two. But the point is, I didn't know. I thought I was just the only one. And so when people were going nuts and getting so excited over these 10 reasons that we don't like our patients, the reasons they annoy us, and people were loving it. And so people started emailing me and reaching out and asking me, how did you do it? I want to quit dentistry too. And cheering me on. And even once you've quit, it's like a very insecure time. You
Hmm.
don't feel great about it unless you've won the lottery or you've started this amazing other business. When I was still somewhat insecure about things, so it was so helpful to have this like built-in cheerleading squad for me to remind me that I was doing the right thing. And so, at this, then to go to this meeting and have people, everyone is excited about this post that I wrote. And then we got into these conversations. Before that, I always felt like when I went to dental events, I felt like the conversation was always so fake
Hmm.
between the other dentists I was talking to and me. And it was like, how's practice? Oh, it's great. How's yours? Oh yeah, it's great too. Yeah, cool. And then that's all you really have to
Right.
say, right?
Yeah.
It's so awkward. So I part of that is because I was being fake,
Hmm.
right? Like I was hiding this huge secret. um but this one night we started having these conversations that finally felt real. And other dentists were saying things to me like, yeah, we are trying to plan for our exit in 10 years or whatever. And I had the best conversations that night because finally we were having a real conversation.
Hmm.
So, if anyone out there is feeling like no one gets them, um, people get people get you. It's just, it's hard to talk about. And we are out there though.
It's that peer engagement is so important to, whether you're still practicing, to realize that you're not the only one going through the stresses of the profession, or like in your situation, if you left the profession, that there's a lot of people out there that, were going through the same thing that you were. Um, so now tell me about Lolabees and your um, uh, coaching. Would you consider yourself a coach, a consultant? What do you specify yourself
Yeah,
as?
I consider myself a coach. I usually focus on career with people, but we can work on anything because I've been trained to work on anything. But really, you talk about niche. It's mostly helping dentists who are unhappy in their careers.
Hmm.
And so, what's fascinating, and I love when I get the dentists that are really successful, they've built these $1 million dream practices. I love hearing from them and working with them because we all think that that's our ticket to happiness.
Yeah.
And and we all think that, at least when we were in dental school, we thought that, well, if you couldn't stay at practicing dentist, it's because you couldn't hack it. And it's
Hmm.
just not true. I mean, there are some of the most successful dentists in our country, or from other countries, who are so successful and patients love them. And maybe they liked it for a while, but they just are, either they're burnt out and they need to find a way to get over the burnout and find some joy in their career again, or it's time for a change.
Yeah.
Recently heard someone called dentistry a terminal career. And I
Hmm.
thought, well, that's a great description, right? This idea that we can't ever do anything else, that we're failures or we're bad people. So, you know, I work with people who they just know they need to change something. So
Hmm.
whether it's changing how you approach your practice so that you can have more happiness, becoming a better leader. A lot of times I'm hearing from young associates that are so unhappy, they're just a few years out. And part of it is, and you see this when you're in your 40s, right? But it's hard to see then. Part of it is their leadership. It's harder for them because they're wanting to be liked so much
Yeah.
more, and they're the same age as their assistants, or their assistants have been there longer or they're older. So helping with that. But also helping people who are saying, I need to get out, I need to change, I can't do this career anymore, because they don't know what to do. Earlier I mentioned we're trained in such a specific area that it's not that translatable into other things. So it's helping people really get to know themselves again and figure out, like, what do I want to do? And then gain the confidence to know that you can do it and have that built in cheering squad, like I gained from my blog post, because without it, it is so normal to like get confidence one day and take one step forward, and then something happens and you think, what am I doing? And you want to just take two steps back. And when you do that, you just stay on the hamster wheel, and you
Hmm.
really can't get out of it. So it's really helping people make the decisions that they need to make about their careers, and then getting into some type of action, because I'll tell you, I know what it's like to just talk and be and no action, and it's really painful. And if you can get into action, then you can start to build momentum, and ultimately there's so much more out there in this world. And dentistry is great, but there's just more. Like, I'm so glad I had to leave dentistry altogether. I went into weight loss coaching. I started a weight loss business. I knew it wasn't going to be my forever career, but I needed out. And now I'm back. And what I'm learning over the years is I loved dentistry. I just didn't like working on patients.
Hmm.
So for me, it was the patients. It wasn't the staff as much. It was the patients. Um, so there's a lot of different ways we can be in this field and out of this field.
Now, your clients do, is it a mix where some of them you work through their issues and give them that, that action to, and then abstain in the profession? Um, is it like 50-50 where some just totally leave, or there's a mix where some cut down their days? Because I'm just thinking, if you're, let's say you're year three and you're miserable, but you're $500,000 in debt, what do you do?
Right. Yeah, that's a great question. So that is oftentimes what happens with the younger dentists that I work with, is they've got so much debt that they're just trapped. So um yeah, we work on how can they find a little more joy in their careers, and how can they tolerate it and cope with it and manage it. And it's not easy. It's pretty hard, but it's a good way of really finding out eventually, is this the right career for me or not, right? And usually people find me, and that's just because of my online marketing, I guess. My online verbiage is really geared towards career change, because I talk about my story so much. But I get a lot of people who come to me thinking that they want to change careers, and once we talk, they realize they want to try it out. See, can I change things? And some people will redesign it, like you said, to cut down their days. I mean, this is all about how can you design your career on your terms. And that's what's awesome about dentistry, is you can work 2 weeks. I mean, sorry, 2 days a week if you want to, and if you can, and if you've set your life up that way, you can totally do that. And so, but we still need to create, like, what are you doing in your life to make those, even those 2 days, tolerable.
Hmm.
So yeah, it's people come to me because they want to quit, and it's probably 50-50. Some of
Hmm.
them ended up wanting to stay in, and then the other ones, I mean, they just get to a point where they know, they're like, and when you find yourself saying, this is kind of my new favorite thing that I keep finding myself saying over and over, is because I said this, and people say it to me all the time. They say, I feel like I'm dying inside, but I'm not sure what to do.
Hmm.
Or like, um, this is crushing my soul, but I'm not sure what to do. And I think dying inside and soul crushing, is that ambiguous? You know,
Yeah,
like,
you need to do
it's
something.
pretty
Yeah,
clear. Like, if you're
yeah.
dying inside, something's wrong and we need to look
Hmm.
at it. So I said it too, but it's because listening to that's your intuition speaking, and listening to what your gut is telling you is very inconvenient, and it creates a very uphill battle. It's not easy, You can look at me now and it looks like doing what I did was so easy, but it's a very long, it can be a painful process, but at the end, it's so liberating. If it's what, if that's the right, yeah. By the way, I'm not here to make sure everyone quits dentistry, right? Like I wanted people to stay in
hmm
dentistry. And so that is what I help people do also.
But you kind of you get to the root of the issues, kind of create a rethinking of what's going on and why they're so miserable, and then create a plan of action where they actually follow through and do it, not just talk about it, but do it and get that motivation to do it. Is this all one-on-one? Is it all through phone or Zoom? How do you communicate with your clients?
Yeah, it's one-on-one coaching. I've been doing it over the phone because not every dentist who wants to do this kind of work is in Denver, right? So I've been doing it over the phone for years. And now I've added Zoom because people are wanting to to connect face to face since we're so isolated again um, with COVID. But either phone or Zoom like this, and it hasn't really changed because that's how it was set up beforehand, which
hmm
is, I'm not gonna lie, pretty nice. But yeah, we do one on one, and I also have a conference that is new, and it's like nothing that's ever been offered for dentists ever. So I'm pretty
So,
excited about it.
so explain what the conference is. That's all, I'm assuming also through Zoom. How does that work?
Yeah, we have a platform that's similar to Zoom, but different. And so it's a virtual conference. It is a full day conference. It's actually it's called the Next Dentist Career Conference. So it's helping people explore, working with me one on one is a much bigger commitment
hmm
than a 1 day conference. I work with people for 3, 4, 6 months at a time. This is a 1 day event where you can really just kind of dip your toes in and find out, is career change right for me? And if it is, here's how I can take some steps to move myself forward. And so it came about because I've been doing this one-on-one coaching for about 4 years, and I had a physician reach out to me just out of the blue who does the same kind of work with doctors, and she started a conference um, to help more physicians really gain access to this type of work and this type of information. And when COVID happened, she had to take the conference virtual and was really enjoying it. So thought she wanted to branch out and asked me, like, she's a stranger, just asked me if I wanted to partner up with her. We got to know each other a little bit, and turns out we are great friends and work really well together. And so we are putting on this conference that she's done with physicians. And
hmm
she always tells me that physicians are about 10 years ahead of dentists in this. Like 10 years ago, physicians were saying there are no other jobs out there, there's no options. And now they've really come together as a community to create options for physicians who want to get out of clinical dentistry. So that's what we're doing. So we're teaching tips, like very concrete tips, to help you, one, understand if career change is right for you. If not, then if career change is not right for you, then how can you design it? Maybe diversify your career and get in, like what you're doing. You've got this new business that's so exciting. I don't know how new it actually is, but you've had this for a while that's like giving you variety. You get to
hmm
practice and do this. So if you don't want a career change, maybe it's just branching out. But we get special guests. We have special guests who are sharing what they do outside of dentistry. And so this time around, our first conference is in November. This time around, all of the dentists have left clinical. Well, one of them has more of a non-traditional clinical job.
hmm
She owns a whitening spa, and the other ones have completely non-clinical jobs outside of dentistry. and they're going to share what they do, how they got out of dentistry, what they do, and how our viewers, like how our audience can do it too. So we're going to have a lot of concrete tips to help people get started. Have I gone too long? Does that answer your question?
Yeah, I was going to ask you. So you have some presenters, and then is there a way for the audience to engage with each other, like through chat
Yes.
or groups?
Thank you for asking that because we do have actually an hour and a half of networking. It's divided up into two different sessions where people, other dentists, you can get into these small rooms. Zoom calls them breakout sessions. I think
Mm-hmm.
we have these little tables you can pop onto and then talk to up to 6 people at a time. And so you can talk to the speakers and get more specific in your conversations and ask questions, or you can network with other dentists. And the networking with other dentists is what keeps us going when we're trying to make this decision.
And does
So we,
your partner also, is it just a dental, just for dentists, or do you have a
yes,
combination of physicians and dentists?
yeah, she's the only physician. Um, at, but the all the like I'm this is for dentists by dentists. So
Mm-hmm.
all the our 5 guest speakers are all dentists and me.
What
So
about
yeah,
your
and all of
husband?
our attendees are dentists.
Are chiropractors as miserable as dentists, or are they much happier?
I don't know. It's a good question. I mean, my guess is it would be the same, right? My
Yeah,
husband loves
although
it. He's one of the ones that
everyone,
likes it.
yeah, I love going to the chiropractor. I love getting that.
Yeah, I think
My
it's could be a little different, right?
Yeah. Um, well, thank you so much. Do you have any last nuggets or words of wisdom for the young dentists out there, before we wrap things up?
The young dentist, let's see. Okay, start off by just recognizing your boundaries and you can actually what I mean by that is you can take care of patients and you can take care of yourself at the same time. You do not have to be that like dancing monkey entertaining everyone and taking care of them while you're sitting here juggling everything. So just take care of yourself
Yeah,
and then
it's so
less
true.
burnout, right?
Yeah, it's so true. Take care of yourself, take care of your mind, and do things that make you enjoy the profession and things outside of the profession that can help you, decompress from the stresses. So, all right, Dr. Laura Brenner, thanks so much for joining us. That was truly inspiring. Again, go to Deals for Dentists and click on the Lolabees listing. Enjoy $50 off using the exclusive coupon, and that's for the networking conference. Also, if you mention this podcast, you get $100 off Dr. Brenner's one-on-one coaching programs. So, thank you so much for joining us, and let's try to be in touch and see what's new in your world in the next 6 months or a year or so.
Yeah, absolutely. Thanks for having me. Let's go back to Tulane again. Let's go visit New Orleans.
I keep saying that I'm going to get back there. Well, now, now I barely leave my house because of COVID, but after I graduated, I said I'm going to come back every year, and I have been back maybe 3 or 4 times. But it's such a great city and such a fun city. And for those people that Bourbon Street is not New Orleans, that is a very touristy place. In fact, I went there for a 40th birthday party, and all my friends wanted to do was just hang out on Bourbon Street. I'm like, there's so
Oh,
much more to the city. Bourbon Street has this combination of, it smells like vomit and urine and booze, and it's a dirty street. Um, Great for tourists, but for people that spent 4 years there, there's so much more going on in the city. That's the music, the food. It's just such a great city. So thanks so much again. Let's be in touch.
yeah. Thanks so much, Eric. It was really fun talking to you and reconnecting.
Yeah, that's great. All right,
Yeah.
take care.
Thanks. You too.